Hi everyone, welcome back to TCM Connections. If you're about to start treating patients in your clinical practice, then this video might be for you. If I had these tips when I started my clinical practice, it would have helped me a lot more. So let's start with when you actually start your treating patients in clinical practice. Typically in a full-time semester load, you'll start your treating of patients in Year 3, Semester 2. Up until then, you'll be an observer in the clinic. You're not expected to know everything. I think you need to know the fundamentals. A lot of students feel a bit anxious and think that they need to know everything and therefore try to prepare and know everything, and that's just not possible. How will you likely progress? So what I've found is the first couple of weeks will be quite tentative and nervous and lack of confidence and feeling of being competent. That's all natural. But simply put, the more patients you treat, your assimilation of the knowledge and your experience, your understanding, your effectiveness all assimilates very quickly. And in fact, your learning and understanding increases exponentially. I've tried to describe it using this graph about the rate of learning and effectiveness, and hopefully that's come through and makes sense to you. Typical things you need to know, and I guess the better you know them and can do them, the more confidence you'll be going into treating patients. Obviously, listening, speaking, and writing in English. The better you are, the more confidence you have, and therefore the more confidence the patient will have in you. Regards to the diagnostic skills, prepare your questions. Sequence your questions appropriately. Maintain professionalism in the way you talk, the way you listen, your body language, and look, do scenario practice with senior students. They've got the insight and they'll be able to help you gain that confidence. When it comes to treatment, the two main treatments is acupuncture and herbal medicine, and obviously there's other treatments such as cupping and gua sha as well. But with acupuncture, know your most commonly used acupoints. We'll cover this a little bit more in the next section. And herbal medicine, look, this takes time to develop. So with the support of your supervisor and plus your homework in memorizing the herbs and the formulas, it'll come together a bit more slowly, but it will come together. Creating a healing atmosphere. So this should be part of every skill in the consultation. Every skill has an element of your focus, your calmness, and your willingness to help the patient. Staying calm. What homework are you doing to improve your calmness and focus? We covered this at the last section. Reception duties, you have plenty of reception duty practice before you actually treat patients, so this shouldn't be an issue. Now, other preparation tips to give you the most confidence. Practice the consultation piece with a senior student because they'll give you insight, as I mentioned before. Practice acupuncture with your peers to gain confidence in needling, achieving dirt chi, manipulating, and so forth. The most common diseases you'll see when you treat, and this is where you don't need to know everything. Know the best acupuncture points to treat the following conditions because they're pretty much 90% of the ailments that patients come into the clinic with. And related to that is the most common patterns. 90% of the patterns will be these patterns. So know the best points and to a large extent know the best herbs and herbal formulas to treat these patterns. It would be good to have some prepared questions about menstruation because you'll get, 1 in 10 patients you'll get to ask, or you'll need to ask questions relating to the menstruation. And because a lot of the patients come to the clinic with musculoskeletal issues, know your basic passive range of movements, active range of movements, your basic orthopedic tests, and pretty much know your anatomy. You won't know it all, but start with the basics just to get you going, and so that you have the tools prepared and not be caught with a mental blank. Okay, so these are the minimum to give you the best confidence. And areas where you will need to get support, and you will be provided with support, is confirming your diagnosis, confirming your treatment principle and treatment plan, and devising and confirming the herbal medicine to prescribe. So these will take a little bit longer to be more confident with, but they will come. Okay, finally, you have to take care of your own health. The main areas are diet. You got to practice what you preach. You got to feed your chi and blood. Exercise every day to maintain a strong body, keep your chi and blood moving, and therefore keep yourself healthy. Get rest and sleep. Sleep is vital to allow you to rejuvenate, because you need the energy to heal your patients. Meditation to harness the focus, the calmness, and the intention when you make treatment, so it allows you to make your treatments more effective. So your patients will be inspired by your superior health without even having to say anything. Your vitality can be healing to your patients, and definitely some of your vitality may be imparted onto your patients as part of the healing process, so you will need to replenish it. Anyway, that's the last of it. So to recap, if I had these tips leading into beginning my clinical practice, I would have been in a better position rather than just winging it. I hope this has helped. Thanks for watching, and I'll see you next time.